Good afternoon. My name is Lori Pack, and I'm CEO of Child Guidance Center, and I'm joined by part of my team from the Strong Families, Strong Children program. And I'll start by sharing a little bit about Child Guidance Center. We were founded in 1967 to provide outpatient mental health services for low-income, at-risk children and their family members. Most of the children that come through our doors come in with trauma, and they also struggle at home, at school, and in the community. I've been with the organization 28 years, and in my latest role as CEO, part of my job is to recognize gaps and needs in our community. So in 2010, I started becoming more and more aware about the needs of military and veteran children and their family members, and looked into Orange County, into our community, to see what are we doing. Met with the VA hospital and recognized that they were primarily treating the veteran. Almost only treating the veteran. So I looked around to other organizations, what are others doing? And there wasn't much being done, if anything. So within our own caseloads, I looked at, from the 1,000 children and families that we serve each month, how many are military connected? And that was about 10%, or 100 families at any one time. So to meet that need, I began to get my staff trained to be more culturally competent. But as we looked more and more at these families, there were other needs that presented beyond mental health or counseling issues. There were needs around housing, legal, domestic violence prevention, ongoing support. So what I did was looked to convene some partners together, nonprofit partners that addressed each of these areas well, because I believe that organizations should stick to do what they do well. So with that, the 5 partners came together, including Child Guidance Center, to look at what we might do to meet the needs of families in this community. So 2015, I'm proud to say that the Strong Families, Strong Children program was officially funded and launched. And there's some innovations about this program that I believe are very unique. And the first one being that we recognize that staff don't just need to be trained. We felt that these families often have a hard time self-identifying and asking for help. Our staff need to have personal military experience, either as having served or growing up in a military family. And I'd like to hand it over to Marilyn to share a little bit.
Part of the unique features of the program is that we are, as Lori said, all connected to the military. I have both been active duty and a family member. And we are, when a family comes in, we're assigned to them for the duration of their time in our program. So we build those trusting relationships, and we continue to take care of them throughout.
Mitzi, would you like to share a little?
Yes, both of my parents served. So I definitely understand the unique challenges of being a family member of military parents. We work to increase awareness about the needs of family members. And bottom line is that our military families deserve our respect and support.
It's absolutely true. So we work not only, with our entire team, our peer counselors and our peer navigators having that military experience, and work with other veteran serving organizations to increase the awareness. And we really believe that it's important that this is a program that should be in every county and every state. So we look toward replication of this model, and that's why we believe it's so important, because bottom line is these families deserve our respect, our gratitude, and support for doing the job that they volunteered to do. So thank you for consideration of our application.